Why do I get back and leg pains before a poo? Hello and welcome back to the channel. In today's video, we discuss a rather peculiar symptom. Back and leg pains preceding bowel movements is a phenomenon that can significantly impact an individual's quality of life. It can actually be rather disabling. Jokes aside, the simple task of performing one of the body's most basic functions may not be all that easy and smooth sailing after all. To comprehend why back and leg pain may occur before bowel movements, it's essential to grasp the physiological mechanisms involved. The digestive tract, or the gastrointestinal system, shares complex connections with other bodily symptoms, including the nervous system and the musculoskeletal system. Basically your nerves and your muscles and bones, joints, etc. During the process of defecation, the muscles in the abdomen and the pelvic floor, the base of the pelvis basically, contract while simultaneously relaxing the anal sphincter. As you can imagine, logical. This coordinated effort involves the activation of various nerves and muscles. The nerves responsible for bowel control are intertwined with those that innervate the back and also the legs. So, stimulation or irritation of these nerves during or just before bowel movements can potentially manifest as pain going down to the back and to the legs. Additionally, the exertion involved during defecation may strain these muscles of the lower back and legs, and this leads to discomfort as well. Beyond normal physiological processes like those discussed above, several pathological conditions or actual illnesses may also contribute to back and leg pain before bowel movements. One common ailment associated with this degree of pain and discomfort in the back and the legs is simple constipation. When stools become hard and difficult to pass, as you can imagine, individuals may experience increased straining, which can cause the lower back and the muscles of the legs to be strained, so basically compressed in some way. Furthermore, chronic constipation can actually lead to pelvic floor dysfunction, which exacerbates pain and discomfort in these regions. Another potential cause is nerve compression or irritation. Conditions such as herniated discs, spinal stenosis, or sciatica can result in nerve impingement, basically pressure on these nerves, causing radiation of the pain that worsens during specific activities, including bowel movements. Similarly, inflammatory bowel diseases like Crohn's disease or ulcerative colitis can also induce inflammation in the gastrointestinal tract, which triggers referred pain to adjacent areas, neighboring areas, including the back and the legs. So basically anything that can cause nerve compression or irritation can by way of association, when there is an increase in the abdominal pressure just before or during defecation, cause pain either in the back or in the legs, depending on where these nerves originate and also what structures they supply with electrical connections. So if you have a nerve that is, for example, going to the top of the leg, but on the way to the back of the leg, it is irritated by your full rectum or full digestive tract, which is loaded with fecal matter, you can imagine that the irritation that this causes, because the nerve is being touched and being compressed by this full bladder, bowel rather, nothing to do with the bladder, bowel. This can of course lead to pain or a weird sensation in the top of the leg, simply because that nerve supplies the top of the leg. And so it doesn't matter where the pain is coming from, the nature of nerve compression is that you can get what we call radiated pain, or otherwise known as referred pain. So even though you're causing a particular problem at one part of the body because of nerves and how they function, the pain can be felt at another area of the body. Furthermore, certain structural abnormalities in the spine or pelvis, such as sacroiliac joint dysfunction, or another condition called spondylolisthesis. This is basically where the spinal bodies, so the vertebral bodies, are not stacked correctly in the spinal column, depending on whether it's pushed forward, one body respective to the other, or backwards, as the case may be. These can also impinge the nerves which run through the spinal column, causing or contributing again to these pre-defecation pains, simply because of the stretching of the large bowel when it's full, causing you to either hold your body in a certain way or move into a certain position, which then exacerbates the nerve compression or nerve irritation, causing pain or discomfort in whichever area that particular nerve which is being compressed touches or supplies with sensation. These conditions disrupt the normal biomechanics of the lower back and pelvis, and this leads to chronic discomfort exacerbated by bowel movements. Sometimes pain or discomfort in the back or legs can simply be as a result of psychological factors, stress, anxiety, depression, and sometimes certain incidents that may have occurred earlier on in our personal histories, most likely in childhood. Some people associate certain problems from childhood, whether it be physical or psychological, or sometimes even sexual abuse, with bodily functions like defecation. Something even as benign as being told off for having had an accident as a child, an accident where you've messed yourself, maybe even in public, or even situations where people have been bullied because they had an accident. These kinds of incidents can result in a kind of a psychosomatic consequence in later life, where you feel pain or discomfort, physical pain or discomfort, just by virtue of this particular bodily dysfunction, defecation, even urination, or other bodily functions, because of the bad association with whatever happened in the past. So psychological factors are quite important in the differential diagnosis of this kind of symptom. One thing we shouldn't forget is that psychological distress can heighten one's perception of pain, amplifying discomfort associated with bowel movement or any other bodily function. The bidirectional relationship between the gut and the brain, which is known as the gut-brain axis, underscores the influence of emotional well-being on gastrointestinal health. Pretty complicated, but when we think about it, this really explains the sometimes rather weird correlations that we pick up when we examine or care for patients with certain symptoms. So now that we've described the problem, how can we manage this particular problem? Now, because these problems usually are so complex, especially when there are psychological overlays, the approach is necessarily multifaceted. Now, the good news is the management or the treatment of these kinds of issues are usually quite simple to begin with, and if the simple strategies don't work, then in a stepwise manner we could go on to the more complex strategies. So starting with the very, very simple, the simplest management strategies, something as simple as adopting a high fiber diet, staying hydrated, drinking lots of water. It is recommended for most adults at least 1.5 liters per day in winter, 2 liters a day in summer, because in summer it's hot, we need more water for the body, is the general recommendation. If we stay hydrated, what happens is that our bowel content is more hydrated, to put it in a simple manner. We are able to evacuate much easier simply because the stool is not hard and compacted. This allows regular bowel movements, so we don't accumulate fecal matter for long periods of time, for days, sometimes even weeks. This causing naturally a build-up, and the longer this goes on for, the harder it is to evacuate eventually. So high fiber diet, lots of water. If this doesn't work, Medications, over-the-counter laxatives, stool softeners may also be helpful. I don't really recommend this on a long-term basis, but certainly in a short-term manner, this can help to alleviate symptoms of pain because of impaction, constipation, or just hard stools. We should, however, try to regulate the problem with hydration, with high fiber diet, and not always rely on medications, because this eventually leads to a lazy bowel, and that in itself becomes a major issue, which more than exacerbates the problem. Quite frankly, it becomes exponentially difficult to manage the bowels when they completely give up and you then have to have this vicious cycle of always having to take medications to solve the problem. Anyway, painkillers can sometimes help, but then again, if we understand the physiological cause and mechanisms through which the symptom occurs in the first place, we can hopefully find an appropriate treatment that removes the need for repeated use of painkillers. Physical therapy can also help in the sense that targeted exercises and stretches prescribed by a physical therapist can strengthen the muscles supporting the spine, and this improves flexibility, thus reducing back and leg pain. Especially pelvic floor physical therapy can be very, very useful for individuals with pelvic floor dysfunction, which can immensely help when this pelvic floor dysfunction includes bowel-related problems. For those with psychological overlay, it is helpful to try certain mind-body interventions, techniques like mindfulness, meditation, yoga, cognitive behavioral therapy. All of these can help manage stress and anxiety, which is associated with gastrointestinal symptoms in general, but especially problems with evacuating, with defecation. And these interventions also can potentially reduce the perception of pain. This is exceedingly helpful simply because just by reducing the perception of pain, you can already eliminate half the battle, so to speak. Because when the problem is that you feel pain where you wouldn't expect to have physical pain, for example, by holding your body in a certain position, for most people it might just cause a mild discomfort, but for a person whose perception of pain is sky high, that particular posture becomes excruciating, and this obviously doesn't help when they have repeated necessity to hold this position because it's the only position that feels at the very least tolerable just before they have to evacuate the bowel. So it's the repetitiveness of it which actually exacerbates the problem, in the sense that if this is the only position you can keep when you need to evacuate the bowel, it's painful, you have a fear of having this position, but it's the only one you can adopt, you can imagine the kind of vicious cycle loop that this can create. So breaking that cycle with a therapy such as cognitive behavioral therapy or mindfulness can really help to alleviate the false perception that has been generated somewhere along the lines, perhaps beginning in childhood or early adulthood, due to some sort of traumatic experience. In the case of underlying structural abnormalities or neurological conditions, nerve compressions, etc., medical interventions like epidural injections with steroids, for example, or nerve blocks or surgical procedures, a discectomy if you have a herniated disc, decompression, etc. These can all be options that can be implemented in the hope of targeting the particular cause that is causing the symptom of pain, discomfort, which happens just before or during defecation. So there we have it, the root causes of why you may have leg or back pains just before needing to evacuate your bowels or even during evacuation. Whilst it may be extremely uncomfortable, rest assured there are simple and effective ways of dealing with it, as we've just described. So, hopefully, if any one of you experiences this, the next time around, know that it's nothing dangerous, nothing untreatable. It is treatable. You just have to know which management strategies to adopt to deal with it, to alleviate it, to at least keep it under control. Until next time, stay healthy.